Well, good morning, good afternoon, good evening, whenever it might be that you're actually watching this. I'm Mark King. I'm the Western North Carolina Conference Treasurer, and I'm coming to you to talk a little bit about insurance, particularly the health benefits plan that we are offering for 2019. I have visited around several of our districts. I still have a few more to go, but this is the video for follow-up as well as for those of you that might not have been able to attend our district event. But before I jump into it, let me just say a word about insurance. You know, insurance has been around for a long time. We can actually trace it back historically to the ancient Babylonians and the Chinese, where groups would come together, they would pool some of their resources so that if a member of the group suffered a catastrophic loss, then they wouldn't be wiped out, that the group would absorb much of the loss and share it among themselves. And so that concept is where we are today. You have probably heard of Lloyd's of London. They perfected the market of insurance into the commercial world. And it was basically for the ship owners of that time as the world was moving out into the seas. And so ship owners would pool resources together. And in that, whenever a ship did not return or was lost at sea, that ship owner was not wiped out financially. So insurance is primarily to be used for catastrophic loss or to prevent catastrophic loss. In the American system, unfortunately, with health benefits, at least for the last 50 to 100 years, a lot of that has changed. We Americans like to use our health benefits or our health insurance as a value option where we pay in and we want to get something back. And we forget that it's designed to help us in times of financial destitution or when we suffer a loss. If we used our homeowners insurance like we do our health insurance, we would probably be filing claims every time we needed to change a light bulb. So I just want to leave that with you as you think about the real purpose and the real reason of health insurance. Now, a word about our insurance here in the Western North Carolina Conference. We are a self-funded plan. And I think there's a biblical basis to that. You can go back into both Acts 2 and Acts chapter 4, and we can read that the early church combined things in one heart and one mind, sharing what they had to help each other. So here in the conference, the clergy and their families, as well as the churches, pay into our pool, and that is the resource that we pull out in which to pay the claims. So it is a self-funded plan. That means basically we are the insurance company. What comes in is what goes out. But I want you to look at the next slide. It's very, very revealing. Over the last 12 months, from August of 2017 to July of 2018, you'll see that the conference collected about $10 million in premiums. But in that same 12 months, just on medical, pharmaceutical, and dental charges, we paid out $12.5 million, leaving a deficit of $1.8 million. Now, thankfully, through the astuteness of the Board of Pensions over these last many, many years, we have investments, primarily with the United Methodist Foundation of Western North Carolina, that we're able to cover these losses. But you still see we are losing our funds this past year. Some years, the health benefits plan, which is supposed to operate on its own, does balance out. Sometimes there's even a slight surplus, and we put that surplus back into the reserves for future years. And so that is in part also covering these current deficits. But the last 2 years, we have seen significant health claims. Our pool in the Western North Carolina Conference clergy and their families, our pool is shrinking. It's not as many of us as there once was. And we're getting older. And so therefore the claims are strikingly high. Let me say a word about our third-party administrators, and again to clarify that we, the conference, is the insurance company. Many of you, I'm afraid, confuse our third-party administrator, Health Graham, as being the insurance company, and they are not. Even in the days when we used Blue Cross Blue Shield as our third-party administrator, they were not the insurance company. We did not use their insurance funds. They simply administered the plan for us. Otherwise, my office would have to employ far more staff to do this. So what HealthGram does is they follow our policies, our procedures that have been approved by the Board of Pensions and Health Benefits to administer our health plan. Claims come in, they apply the discounts of our network, they issue the explanation of benefits, and they pay the claims directly to the hospitals, the physicians, and the healthcare people. And then we reimburse or pay them each month. The same works for Pharmavel, who does the third-party administration for our drug program. We are in the primary physician care network, and this network covers the major medical centers and systems of Western North Carolina. This affords you the opportunity to have discounts and reduce fees over the usual and customary charges. Western North Carolina does purchase its own stop loss, which is a type of insurance for us. In other words, for this past year, whenever a single claim approached $250,000, anything above that, the conference is reimbursed. Then the next levels are $200,000 for all those that might hit that amount. But that means that a single claim is coming in or a single illness is coming in to hit those amounts. For years, we never used stop loss. But for the last couple of years, we have seen it hit several times. And in fact, this year, it has already hit about 5 times. You can imagine how that impacts our charges and fees. But we do have that in place. We do pay for that so that we again spread out our potential loss with others. For 2019, we are very pleased to offer again our 2 basic plans, the Basic and the Basic Plus. The Basic plan has a reduced premium, but it also has a higher deductible, higher co-pays, higher co-insurance, the part that you pay. The Basic Plus plan has a higher premium, but it has lower deductibles, lower co-pays, and lower co-insurance, the part you pay. The difference between the two primarily is one, you have a reduced cost up front. The other, you pay a higher cost up front in anticipation of not having to pay as much in the year for health care. I do remind you that the churches are always charged the same amount for both plans. If a clergy person wants to use the Basic Plus, they pay the difference between the 2 plan premiums. For 2019, because several of you have requested it, we have been exploring it and investigating it, we're going to be offering a 3rd plan option. This is the Health Savings Account plan. The Health Savings Account allows you to set up a health savings account with another financial institution, some third party, be it a bank, a credit union, an investment firm, plenty of options out there for you to explore. And you're able to put money into this health savings account in order to pay for your medical care and costs. The health savings account is yours, as opposed to the flexible spending account option that we offer here at the conference. The HSA continues beyond this year. It is not a use it or lose it like the FSAs are. You can invest it. The funds that you put into it can be a tax deduction for you, either by participating in a pre-tax payroll deduction with the church that you serve or your employer, or it can be put in and you simply use your own tax return to record the deduction. As always, please check with your tax advisor for the actual deductibility in your particular situation. The Affordable Care Act, which is still the health law of our country, plays into each of our plans, and the conference has to abide by its rules and regulations. As such, the HSA must be paired with a high deductible health plan. What this means is that this plan option has a deductible that you must meet and pay for before any insurance will actually kick in. For our plan, the individual deductible will be $5,500, and the family plan, be it a spouse, child, children, or family, however those 3 you may offer, is $10,000. Now what that means is that From day one, you will be responsible for meeting those deductibles before the conference will pay anything. However, the gist is that you would be able to use your HSA funds to do that, because any funds pulled out of an HSA to pay for health care does not trigger a tax consequence, as well as the earnings that may come into your HSA likewise. 2019 is allowing a maximum for the individual HSA contribution to be $3,500. For family coverage, an additional $3,500 is allowed. And if you or your spouse, either one or both, are over 55, you would get an additional $1,000 per to put into your HSA. Again, as I said, these funds go with you, stay with you year after year after year. So in technical terms, you could fund your deductible completely if you don't pay it out in any medical cost within 2 years. One of the other things that we're doing in bringing this plan out is that the conference, should you elect the HSA option, will seed it. In other words, you give us verification that you in fact have an HSA with a third party. For the individual, we will put in $400. For spouse or children coverage, we will put in an additional $400. And if you elect the family option, we will put in a third $400 for a maximum of $1,200. For 2019, the Health Benefits Committee made a recommendation and the Board of Pensions and Health Benefits adopted the following increases and changes to our health plan. For the basic plan, it will go up 8%. The Basic Plus plan, as you can imagine, pays out more in claims, will go up 10%. And this will go across all bands, individual coverage, children, spouse, as well as family. The amount the churches pay for the Basic and the Basic Plus, as well as the HSA, are the same amount. The reason we keep these at the same amount is that we don't want the churches to pressure the clergy to go into one plan or another that might in effect save them some dollars. It's your option to choose which of the three plans you wish to participate. The Basic Plus, however, has an additional premium of $3,665 that you would pay out each month in order to opt for that plan. The HSA is priced at the same amount as the basic plan, so there is no difference in premium you have to pay out. In addition to the cost adjustments for the active plans, we have also adjusted the salary scale slightly so that clergy will be paying in about another 1% than what they've been used to. We've also changed a couple of the co-pays, raising them no more than $10 for specialized care visits or for certain high-end drug costs, all in an attempt to keep our costs as contained as we possibly can. The Health Benefits Committee and the Conference Board of Pensions and Health Benefits were absolutely committed that the premiums next year should not rise for the churches more than $1,000. And the Health Benefits Committee and the Conference Board of Pensions and Health Benefit have achieved this end. One other thing I'd like to share. Going back to that idea of insurance being a way to mitigate catastrophic loss, in all three of our plans, I want you to know something. If you stay within the network, the maximum out-of-pocket you would have to pay for the basic plan on the individual basis is $6,000. For the Basic Plus, it's $4,000. And for the HSA, that deductible of $5,500. And on the family side, the maximum we would have to pay on the basic is $3,200. On the Basic Plus is $12,000. And on the HSA is that family deductible of $10,000. I hope you're hearing what I'm saying. That is the maximum out of pocket you would ever be hit. And can you imagine those that experience these $200,000 plus charges? This is where insurance is coming into play as we care and covenant for each other so that no one has to pay more than these fees that I just outlined. For you retirees, I'm very pleased to announce that once again for 2019, there will be no changes and there will be no price increase. This is primarily due to the fact that the retiree plan has an endowment associated with it. And the endowment feeds in each year into our system and to our plan to keep these costs low. I jokingly say, but also tongue-in-cheek very seriously, we need to get an endowment for the active plan so that we can have the same kind of benefit. Two new valued-added offerings that I'm very excited about for 2019 are going to be offered. One of these is called Health Map, and it is open to anyone in the conference on our health plans to apply. It is targeted for those who are suffering one of these three chronic conditions: cardiovascular disease, which includes high blood pressure as well as high cholesterol issues, depression, and diabetes. If you are accepted into our program, you will be paired with a pharmaceutical coach. It will all be entirely confidential. The coach will review your medical records, including your drug regimen and your last visits with your physician. We'll have questions and a time to meet with you about diet, exercise, just your whole routine. And together you will formulate a plan toward a path of wellness. This plan has been very successful with other organizations that have used it in helping not only address the issues that challenge in your life, but also get you to a point of feeling better and perhaps on a greater path of wellness. And if you will complete the program as you and your coach develop, you will receive a $200 gift card as an achievement reward for it. But more than that, it is our hope that you will have a healthier life and one in which you can enjoy all the more. The other offering that we're going to be bringing is that the Western North Carolina Conference is moving into the world of virtual medicine. It is called Health Perks. We will begin registration of this program here in the fall of 2018 to launch in January. But this is a program where you will have access to a board-certified physician 24/7. You can use your phone or electronic device to do Skyping or FaceTime, as well as a regular telephone to make a phone call. Once you're registered in the system, they will have access to your medical records. And then when you have that 3 a.m. cough that you can't get rid of, or that child has that fever, or something's happened and you're not sure whether you should go to the ER or not, you can make this kind of call at no cost to you and relay your symptoms to the physician. Now, the physician may in fact say, go to the ER. Or they may say, it sounds to me like you have this and I'm going to prescribe such and such for you. It may save you a lot of time and effort in your health care. Now, this is never meant to replace your primary care physician. It is simply a supplement to. But we hope this will be a helpful addition to our health plan. Finally, we're going to be offering the flexible spending accounts as well if you're on the Basic or the Basic Plus plan. You cannot have both a medical FSA and an HSA at the same time. You have to have one or the other. If you have the medical FSA, of course, then you would have to be on one of our two basic plans. The maximum that we know as of September 2018 that you can put in for 2019 is $2,650. Usually the IRS releases in November what the amount for the next year will be, and as soon as we know that number, we will certainly release it and pass it on to you. The medical FSA is available to you January the 1st, all the funds, regardless of how much you put in. But always bear in mind, it is a use it or lose it. You do have the ability to roll up to $500 over into the next year, but if you don't use all of that, or if you have more than $500 at the end of the year, it won't be available. The Dependent Care FSA, likewise, is used to reimburse you for the cost of dependent care. It can be children, or it can be an aging parent, or someone in which is your dependent that you care for. This amount, the maximum amount doesn't change from year to year, and it is $5,000. And we anticipate that will be the maximum for 2019. Now, hear me to say on these, you don't have to put in the maximum in order to participate. You need to evaluate what you might spend and allocate accordingly. One last thing. If you want to make a change, or if you want to enroll in one of these, what do you need to do? And this is where I really need you, if I put you to sleep, to wake up and hear what I have to say. For a change in one of our health plans from Basic to Basic Plus to the HSA, if you don't want to change, if you want to stay on the same plan you are right now, you don't need to add or delete any dependents on the plan you are now. You don't have to do anything. That will be automatically carried over. But if you do want to change plans, or if you do need to add or delete dependent coverage, we require an open enrollment form, and you can get those on our website. If you are in the flexible spending account arrangement, whether medical or dependent, and you want to do that again in 2019, we have to have a form. It is the law, it is required, we have no way around this. Now, if you're on it and you don't want to continue in 19, you don't have to do anything. But if you are on it and you want to continue, we have to have a new form. Don't just put on your clergy comp form the amount you want to set aside. We don't always get those. We have to have the enrollment form as a part of our records. We need all these forms to Treasury Services by December the 1st, 2018. This is so we have enough time to get everything ready for you to roll out come January the 1st. If you get it to us later, that doesn't mean we can't do it. It just might not be ready for you by January the 1st. I hope this has been helpful. Please, anytime you have questions or issues, you may call me or Dale Bryant, the Benefits Administrator here in Treasury Services. Email us, call us, come see us. We really do want to help you. And I want to just say this. The Health Benefits Committee and the Conference Board of Pensions and Health Benefits are good people. They labor as a volunteer on both of these boards. They really do have the conference clergy and their families in mind with our plans. We're not here to make money. It's not about a bottom dollar. It is about our charge to care for you so that you can be freed to care for the others of God's people in our conference. They do the best they can. Please always keep that in mind as we work forward into presenting these options. Thank you.